Okay, it's Dr. Buford here. We're just getting, hold the camera for a minute. We're just getting started on this right knee. And you can see this little loose piece of meniscus here. We're going to go ahead and, with our shaver and a little bit of suction, we can remove that pretty quickly. And that was just loose in between the femur and the tibia here on this medial side. I'll tell you, before we do much here, we're going to have a look at the rest of the knee because we're going to spend most of our work in that medial compartment. So here's the ACL. Your knee was stable once you're under anesthesia. That looks good. And then as we get to the lateral compartment, so far, hold that for me, and then hold this up here. So far, so good on this lateral side as well. We're going to bend your knee up. And then push down. Preston, can you turn up the brightness for me a little bit? The brightness on both of them. And so this lateral compartment, keep going. There's a brightness on the other upper box too. You can put that one on 100. Yeah, there you go. Okay, and so now we get a good look at this lateral meniscus. We'll probe everything as well, but that sure looks really good. I just wanted to get a good idea at the beginning here. Okay, so as we look in the patellofemoral joint on this left knee, I think I said right knee at the beginning. It's your left knee. We see the femur, distal femur right here down below. That's the trochlea. Up above is the patella. And as we pull back and look down the front of the knee, that cartilage all looks pretty good all the way down the front, so I'm happy with that. And so now we're going to sneak back into this medial compartment here and decide what we're going to do with the remainder of this meniscus. Remember, there's already one big loose piece, but now we have to decide what to do with the rest of it. Okay, so as we're getting a look at this meniscus, it's torn not only underneath here, that type of tear, you can't really put a stitch in. So it may just be that we resect the part like that that's not repairable and just do our PRP injection. As we look at the chondral surface, we can see here that you've already started to have some wear and tear changes on the cartilage as well. So we'll decide what to do with that in a minute. Okay, so that's the area that we're concerned about here. Pull it out. Put that outflow back on the scope for me. Okay, we're finally just back to that undersurface split. We're going to put in our shaver next. Okay, so let me give you a shot. Here's where we're at on the medial side here. We've resected that back. And we've got that back to a stable rim here. The posterior horn, we're not quite done there yet. We're almost done, but you can see that looks pretty good back to there. I'm going to switch the camera back to the lateral portal. But we're almost done. Okay, we're just finishing up here on the posterior horn, as you see. And we've got this back to a stable rim also. You had a little bit of a chondral lesion on the femoral condyle that we've also taken care of. But all in all, I think things are in pretty good shape. We're going to use our PRP injection. Hopefully that'll help stabilize things as well in terms of your symptoms. So you can see there's a little bit of a chondral flap tear. It wasn't full thickness, so that's good. And we'll finish up here and get this last little flap taken care of, and then we'll get you back to the recovery room shortly. So good luck to you now. I hope this does the trick for you, okay? Bye-bye.